column. So to start off with, when we're talking about the vertebral column, we're talking about the spine, which includes the cervical, thoracic, and lumbar. It lies midline on our dorsal surface or our posterior surface. And there are basically three different functions that it serves. Number one, it encloses and protects the spinal cord. The spinal cord are the bundle of nerves that send the messages to our muscles, to our different systems within our body. So that main channel protects the spinal cord from injury. Number two, supports our head and the trunk of our body. Without the spinal vertebral column, our head would be like a bobblehead, basically. There wouldn't be any support for the head. Number three, it would be that it provides muscle attachments. All our muscles, not all, but a lot of our muscles will attach to the vertebral column, whether it is for in between the vertebrae or for a major muscle such as the psoas muscle. The vertebrae themselves are very irregular in shape. A total of 33 vertebrae we have a total of 33 vertebrae. And if you notice here, 24 are true movable vertebrae, and then we also have the sacrum and coccyx. So what we're saying here is that we have 7 cervical, 12 thoracic, 5 lumbar, and then the sacrum and coccyx for the total. Now if you do notice, they are a little bit different in their numbers. Let's see if I do my math. 7 and 12 is 19, 19 and 5 is 24. Then we have the sacrum and coccyx. But they're saying 33 because of the fact that the sacrum and coccyx are fused vertebrae together. Some anatomy books say 5 to 7 sacral vertebrae compose the sacrum, while 3 to 5. These numbers have been argued, it seems like, for the past couple of years, where now they're saying that there are 5 sacral vertebrae, just an FYI, and that there are 3 coccyx vertebrae. So it is divided into the cervical, thoracic, and lumbar. There are 2 main curvatures that we need to be aware of, and that would be the lordotic and the kyphotic curves. The lordotic curve are the secondary curvatures of the spines. For example, the cervical and the lumbar would be a lordotic, while the thoracic would be the kyphotic, and also the sacrum coccyx would be the kyphotic curve. Now, the best way to remember this, I think, because this comes up quite often, the kyphotic curve is the same curvature as a fetal curve, meaning that if you can imagine a child or a fetus in the womb, that their knees are drawn up, their elbows are drawn down, their head is drawn down, so the curvature of the spine would be forward. That is considered a primary curvature. That primary curvature is a kyphotic curve. The other 2 curvatures of the cervical and lumbar, as we develop, become more prominent, and those would be the lordotic curve. Questions? So we can see that throughout our growth in the fetus, we have a forward curvature. Don't lose sight that this curvature, the patient's facing towards the right. This one, they're facing towards the left. So forward curvature, kyphotic curvature. primary curve. Then you can see the development of the lumbar and the cervical occurring. And then we tend to have the S shape at about year 2. Year 6, definitely it is prominent where we have the kyphotic curve, kyphotic. These two are the primary curvatures. The lordotic would be the cervical and the lumbar. Two other curvatures that can occur are, or not two, but a lateral curvature of the spine and twisting of the spine is known as scoliosis. This AP view of this particular spine, we can see that the spine is twisted out towards the right side. So there's lateral curvature towards the right, and this is known as scoliosis. Scoliosis itself can only have the lateral curvature, but can also consist of a rotation in the spine and a curvature. So you may find that many of you have done scoliosis procedures already, where you find that you see the S shape laterally, but then if you really take a close look at the vertebrae, there is a rotation, or where one hip might be anterior to the other. So there's a double curvature. One hip will always be higher than the other, usually, with scoliosis. So once again, kyphosis and lordosis. Kyphosis would be within the thoracic spine, and also it should be the sacrum and coccyx. Lordosis would be in the lumbar region and also the cervical region. When we hear the term often, the term kyphosis, or that patient is very kyphotic, it tends to be an older patient. It tends to be someone who is hunched over. So that's another way to retain the knowledge that a kyphosis is someone who is doubled over forward, older because of degenerative disc changes, where the vertebrae start collapsing and then they start leaning forward because of the vertebrae body is now becoming more and more narrow. So that'd be kyphosis. Once again, I find it easier to remember kyphosis rather than lordosis and the primary curvature because of the natural fetal position going forward, and then also that it would be the same forward curvature in a kyphotic curve. Questions? Okay. Note the scoliosis in this image, quite significant. Do note that the crest of the pelvis is higher on the right side than the left. This is an extreme kyphosis. There's scoliosis. There are actually two curvatures, one here laterally towards the left, one towards the right. And the problem, if not corrected, is that it will continue to become more prominent in the lateral curvature, therefore compressing the abdomen and also compressing the chest, which patients will have difficulty breathing. Normally, it affects females more often than males. And one of the ways of actually treating it is that they'll be in a full body suit or a plastic suit that causes them to straighten out. And if not, maybe some of you have seen metal rods down through on the posterior part of the back that literally fuses or doesn't allow for the progression of the scoliosis. Here's a picture of a kyphotic patient. As I stated earlier, that kyphotic would be going forward. Do you note that the vertebral body, this particular one, which is 12, might be 11, note how the body is uniform in width from the anterior side to the posterior. But as you go upward, Note how the anterior body is now becoming compressed more and more. These are really bad. The compression of the anterior body causes the curvature to accentuate in the kyphotic curve. I'm sure many of you have done chest x-rays and that you may have had to turn a 14 by 17 into a landscape rather than a portrait, or that maybe the patient presented looking at the ground. That would be a kyphotic, that'd be kyphosis.